Aidet is a technique used for communicating with patients. This was originally developed by the Studer Group, which is an organization that is primarily designed to help hospitals and other healthcare organizations to improve performance. PIH Health adopted this technique a number of years ago to make sure that we are using a standardized communication format when we're talking with patients. A lot of other healthcare organizations also use this technique, including some of our neighbors like St. Jude, and in San Diego, the Sharp Health Systems also use this technique. Aidet is an acronym that stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. We'll go through each of these items individually in the following slides. We acknowledge the patient when we first enter the room. This, of course, starts with knocking at the door, asking for permission to come in, making sure that we're attentive, greeting the patient in a positive way, and also paying attention to the other people in the room, making sure that we're greeting them as well, acknowledging everybody that's in the room. The next step is to introduce yourself. Here's where you're going to tell them who you are, what you're going to do, what really the purpose is you have for being in their room. Imagine being the patient and all day long you have people coming into your room doing lots of different things. It's really nice to know what exactly it is that you're doing. The person who walks in and doesn't say what they're doing can be sometimes even confusing to a patient who maybe doesn't see very well or doesn't hear very well. So it's very important that we're being as upfront as possible about what we're really there for. Letting the patient know how long we're going to be there can also be helpful. So this might be, Mr. Jones, I'm here to help you fill out your menu. This is going to take just a few minutes. Something like that, to just give them idea of the duration. For a test or something else, this might be much longer. For us, this is usually a pretty short period of time. The explanation portion, this might also be something that it's more important when somebody is conducting a test, but for us this might be an opportunity for us to tell the patient the type of diet that they're on, or maybe ask them if they have any questions about the diet, or to ask them if they have any preferences or any other information that we might want to know about what it is that they would prefer to have on their trays each day. So this can be a great time to discuss with the patient what it is that we can do to make their stay as good as possible. The most important last step of the Aidet is to thank the patient. And this is to say thank you for letting us take up their time and to bother them to come into their room. Imagining that their room is sort of like their home for the short time that they're in the hospital, that to thank them for their time is important. And do that with a smile on your face, because that's going to make a big difference to them. Next is a short video where you can see Aidet in action.